RealView is a workflow management and communication software tool that brings real-time visibility, information, calm, and control to an otherwise chaotic and always changing surgical environment. Ask yourself 3 questions. Does my surgical department struggle to get our first OR cases started on time each day? Do we have visibility across our entire department to identify unexpected events or delays? Is our staff dealing with phone calls and pages all day long to keep our OR schedule moving? With RealView, physicians, OR management, and staff are continuously provided with the latest status and location updates for each patient without having to enter data manually. When patients arrive the day of surgery, they check in with your admissions clerk. A RealView care tag is then assigned with a barcode number unique to the patient. Once the care tag is activated, RealView automatically notifies the PreOp desk that the patient is in admissions, and the PreOp nurse escorts the patient to the PreOp area in preparation for surgery. RealView sensors in the PreOp area recognize the patient's care tag and automatically capture the patient's arrival time, instantly notifying the anesthesiologist of the patient's location. After the IV line is in place, the patient's RealView care tag is attached to the IV line. When the patient is ready for surgery, the nurse can press a care tag button or click the computer screen, sending a signal to the OR and the RealView command center at the OR control desk, indicating that the patient is ready for surgery. The OR can also indicate to the PreOp nurse that the room is ready for the patient at the computer workstation in the OR. When arriving in surgery, the RealView sensor in the OR recognizes the patient's new location and time of arrival. This real-time information automatically notifies the command center, surgeon's smartphone, OR dashboard, OR director's tablet, physicians and staff lounge dashboards, and the family waiting room dashboard. The patient's family can also be notified by text, email, and website, which are all HIPAA-compliant messages. During the surgical case, surgery start and end times can also be captured using the patient's RealView care tag or at the computer workstation in the OR. RealView provides user-friendly, web-based software that can be displayed on any hospital computer or workstation. When the patient leaves the OR, RealView automatically notifies your PACU department that the patient is on the way to recovery. RealView also notifies your housekeeping department that it is time to clean the operating room for your next surgical case. RealView automatically informs the entire surgical department on what they need to know and where they need to be. It also provides the latest real-time information at the patient's bedside. Even with unexpected changes in your surgery schedule, like a surgery case that is taking longer than expected or adding an emergency case, RealView allows your staff to instantly see delays and exceptions as they are happening. RealView provides your surgical team with the ability to take action with real-time tools to quickly adapt staffing to your patient flow and meet the new demands of your continuously changing environment. RealView also automatically provides patient status updates to your waiting families.
RealView does really a good job at freeing up our time in order to take care of the patient, which is what we're here to do.
RealView is a lean visual management tool that eliminates hundreds of phone calls each day. The system provides the latest real-time updates for every surgical patient, empowering your physicians and staff with self-governing tools that optimize your surgical department's patient visibility, communication, and efficiency, leading to additional cost savings and revenues. Consistent on-time performance also means happier, more satisfied patients, families, physicians, and staff.
It's about process improvement. If you give employees the right tools and the right process, they'll be successful.
Imagine starting every surgical case on time, knowing the location and status of every patient, and having all the latest information you need to make decisions that will optimize your hospital's surgical care each day. With RealView, it's all possible, every day in real time.